Next, I would like to introduce Lisa Epp to discuss ASPEN's recommendations for blenderized tube feeding. So this is the second EN session, so feel free to stay. And I'd like to welcome Lisa Epp.
What do you put? Okay, I do not do well standing in place, so I will tether myself to this podium. You can see my financial disclosures here, but another disclosure is I'm talking about blenderized tube feeding today as an option. I'm really not going into why would you do blenderized tube feeding, what are the pros, what are the cons. This is more just to say you've maybe already considered this as an option for yourself and how would I do this. My objectives here. So one slide, just to kind of give an overview, the pictures that we have here, we actually sent cameras home with our patients and said, take pictures and show us what this looks like in your home. But I've listed here along with some references just as why some of my patients or why consumers might say that they want to do blenderized tube feeding. So improved bowel regularity, help with the good bacteria in our gut, improved satisfaction has been noted, decreased vomiting or decreased retching and gagging, potentially cost saving, accommodate food allergies or food intolerances just because you want to, and potentially improve tolerance. So I have the references here as well as the end of my slides, but I don't really want to go into the details of that because the purpose of the talk is kind of, I've decided I want to do this, what should I consider next? So the first thing is discuss it with your healthcare team. Now, how I became kind of interested in blenderized tube feeding, I had been working at Mayo for maybe 4 years. And of course, I felt like, oh, I've arrived. I'm in this practice of seeing patients at home on tube feeding, and I feel like I know what I'm doing. And I was talking with a patient, and he's like, super stable. I was like, is there anything I could do to make your life on tube feeding better? And he said, well, I'm going to be honest with you. If you could get me a bigger French size tube, that would be great because the blended sardines that I make just keep clogging up this tube. And I'm like, what? Blended sardines? He's like, well, now that I know you, I can just tell you, I don't use what you have prescribed for me for the last 4 years. I donate that somewhere and I blend up my own food. And I thought, okay, I got to learn about this because people are feeling like they're needing to hide this from me. And that's exactly what I know some of you might be feeling like. But with these new ASPEN guidelines and resources out there for clinicians, I feel like it's going to help really take away that fear that a lot of clinicians have. So that's why I say discuss with your healthcare team. Don't feel like you need to be secretive. Make sure you have resources available like time for yourself and time with a clinician that can help you, and the equipment that you need, which I'll talk about. And then really think about, what do I want this to include? Are there allergens that I want to remove? Are there certain foods I don't want to have? And am I using it to manage something like reflux? We might want that to be a little bit thicker, or for constipation, making sure that we have enough fluid and enough fiber. So there's really two options, and at first we did not have prepared blenderized tube feeding. I'm going to tell you that's what ASPEN has decided to call home blenderized feeding, is prepared blenderized feeding. So that's all we had at first, and then we have now a lot of commercial products. So when you compare the two, the differences are going to be cost, but really that's based on your individual insurance, because I have many people say it's actually cheaper for me just to blend family meals because the formula my child was on is really expensive and our insurance doesn't pay for that. On the flip side, if your insurance is paying 100% for your formula and you're going to start blending foods that are expensive like organic kale and blueberries, that might be an increased cost. So I don't really think we can make a blanket statement that one is more or less costly. Same in terms of time and energy. You might think that preparing your own blenderized feeding is going to be more costly time-wise, but if it saves you time in laundry from vomiting and time from worrying about your loved one tolerating feeds and things like that, it might be actually a time saver and an energy saver. Lastly, I think this is kind of where a lot of clinicians have worried in the past is about microbial contamination of making your own formula. So obviously, if you have a commercial product, in theory, that would be less likely to have contamination. However, these can really be mitigated with good food safety practices. So you might be wondering, kind of the question that we had before about French size, how do I mitigate clogging my tube? Because people really worry, I'm gonna have this thick formula and it could clog my tube. So this group of about 10 content experts got together with ASPEN and did a literature review and really tried to answer these questions. And the way that we felt was the most evidence-based, but also somewhat easy to do at home, would be to measure the blenderized feeds using the International Dysphagia Diet Standardization, which might be a very foreign concept to you, but really what it means is a measurement of how viscous or how thick a blended formula is. So you can see with liquids, like on the bottom, we have thin liquids, then slightly thick, mildly thick, moderately thick, and extremely thick. So I'm going to use that kind of as a comparison. And you can measure that at home. So as you're starting to build your own recipes, it's a great safety net to say, okay, mildly thick formula will work this way. Moderately thick formula will work this way. So this concept here I'm going to use throughout some of the recommendations. So you can see that you would put the blend in a syringe and follow this process, and it would tell you essentially how thick your blend is. So you can see at the top, extremely thick is the most thick to thin liquids. So what do I need? Normally, a gastrostomy tube would be preferred. However, nasal tubes, the group felt like, could be used on a case-by-case basis, as well as jejunal tubes could be used on a case-by-case basis. We're really unable to make specific recommendations about jejunostomy tubes just because the hang time of a home-prepared feeding is 2 hours. However, many of the commercial products have 8, 10, or 12-hour hang times, which likely can be used with jejunal tubes very safely. Both legacy and small bore connector tubes have been studied with blenderized feeding, and both of them work. A 14 French or greater tube is preferred, but I will say this is really based on expert consensus. If you look at the papers that are published, all of them go back to really a paper that was someone's opinion, and actually down to 10 French tubes have been studied to be able to be used for blenderized feeding with thinner blends, but the group felt like if we say 14 French, that's kind of a safety net. There's really no evidence that your tube will wear out more quickly or need to be replaced more quickly, and no evidence that they clog more quickly. Again, we looked at all the evidence out there, and some of them looked at clogging, and there wasn't a difference between commercial products and blenderized products, even though I know we think that should be a greater risk. As long as we're flushing properly with water before and after the feed, really that risk can be mitigated. So you might be asking yourself, what blender would you use? Now, if let's say you have your jaw wired shut and you're gonna be on enteral feeding for 3 months, you might choose not to invest in a $700 blender, right? So the duration of therapy should be taken into account, but there's really great options with professional grade blenders, a jug blender like that you can get at Walmart or Target, or a wand blender like an immersion blender. Our group did study blenders, and the blenders that were on the market at the time, the Vitamix is kind of touted as the gold standard. It does produce much smaller particle sizes than other blenders, and the smaller the particle size, the less chance of it clogging the tube. However, increasing blending time of kind of a less expensive blender to 3 to 6 minutes really actually does produce small particle sizes like the Vitamix. But if you can imagine turning on a blender for 3 or 6 minutes, it's a really long time, and it will blow out the motor more quickly. So if you're going to be doing that frequently, then it might make more sense to invest in a Vitamix. So one of the questions we asked is, can you make a big batch of blenderized feeding and then freeze it for later use? And the big distinction I want to make here is when you make your own blenderized feeding, that follows the USDA guidelines for food. It's not a formula. We're not considering the ASPEN guidelines for formula. It's really the food safety guidelines. So absolutely, you can freeze a big batch and thaw it and use it later. We want it only in the, or take it out of the refrigerator that you're gonna use it within a day. We want you to thaw it safely, just like you would any food, but likely it will have to be reblended when you take it out of the freezer. Hang time, this is the number one takeaway I want you to leave with, and that is that if you prepare your own blenderized feeding or you add a food ingredient to any commercial product, it decreases the hang time to 2 hours. I wish there was evidence that would show us that using ice packs or other methods would mitigate this, and I'm hoping that in the future we will have that research, but right now we just don't have any research to show that there is anything we can do to decrease or increase the hang time of a prepared product. We want you to store it in the refrigerator and throw it away after 3 to 4 days, just like we do leftovers. Unlike the commercial products, which we're following the ASPEN guidelines for, you want to discard that after it has been refrigerated for 24 hours. So cleaning of the blenders is actually one of the things that really mitigates the bacterial contamination of making your own blenderized feeding. Most blenders have their own manufacturer guidelines as to how they recommend cleaning them, but actually the FDA has a really nice process, and it's what some of the studies have used to have people do home blending at home and really decrease the bacterial load of those blends. So taking the blender apart, soaking it in a bleach water bath, letting it air dry, those types of things can really decrease the risk of bacteria growing. The administration sets, however, like a gravity bag or like a pump bag, we really don't have great guidance on how we're supposed to be cleaning these products. And so right now, with the evidence we have before us, the recommendation is to rinse the bag with safe drinking water between use to clear any debris. If it's in the hospital, it's likely going to be thrown away after one feeding. At home, the recommendation is then that bag be stored in the refrigerator in between uses and discarded per manufacturer guidelines, which is 24 hours. So rinse it out after breakfast, put it in the fridge. Rinse it out after lunch, put it in the fridge, throw it away after dinner. Now, our group did kind of put forward a question, and that is that other feeding supplies can be cleaned using these CDC guidelines for like bottles and syringes and medication adapters and things like that. And the question is, should feeding sets be put into that? And so we hope somebody will provide further evidence for us, because it would really help mitigate the bacteria that could grow in a bag if we were able to clean it with this water bleach solution that other feeding supplies can be cleaned with. But right now, we don't have that evidence. So some recipes. You might be thinking, well, I am interested in doing this, but how in the world do I get started? And so looking at websites from a federal agency, a large professional organization such as Oley or ASPEN, to really look at what resources there are there, which there are a lot. The three options that I've given you here are things that I feel like are easy for you to do at home. And I just want to point out, you're going to see some pictures and syringes of blends. So this is from a patient of mine who's very into, so she uses the 500 calorie base recipe that I'm going to show you. And she is really into colors. So for all different holidays, for Halloween, it's all orange and black and red, white, and blue for 4th of July and things like that. So you're going to see some of her colors here, which are amazing. And all of them are based on this 500 calorie recipe, just swapping out some of the foods. So the first one I'll mention is the complete website. So anyone has access to making a profile on the complete website, and you can kind of put in a calorie level, your goal volume, any allergies that you have, and you really build recipes using categories. So it first gives you a list of, here's a nutrient-rich base. So that might be a plant-based milk, that might be a dairy milk, that might be a commercial product. Also, other categories like fruits and vegetables that are high in vitamin A or high in vitamin C, or calcium-rich foods, protein-rich foods. So it kind of gives you a food list to choose from. And then it builds a recipe for you, creates a shopping list of the foods that you need to purchase to create that recipe, and allows you to print a PDF of that recipe, so you could take it into your healthcare provider and kind of say, this is one of the recipes I'm thinking about using. Would you be able to take a quick look at it? Providers can also use it to help you build recipes as consumers, and it's a great way to kind of take ownership, I guess, of your own recipes. So these, like I mentioned, are the categories that you choose from. So the nutrient-rich base, the protein foods, fruits and vegetables, potassium foods, grains, and healthy fats. Did not mean, back. Okay, so what are some features of this? It allows you to make a seven-day meal plan. You can customize the recipes for exactly what you want. It calculates the volume, which is great, because if you have volume intolerance, if you say, okay, I can only have 750 meals a day, or I can only have 1,000 meals a day, it helps choose food that are more nutrient dense. For example, a piece of bread is probably going to add more volume as a carbohydrate than, for example, grape nuts, which grind up and don't add a lot of volume. So it helps pick foods that are in the categories that don't add as much volume, helps you with your shopping list, and like I said, it gives you a PDF that you can take to your healthcare provider. So I'm going to tell you, this is the way that I am most comfortable doing home blends, and this is how. So we have about 2,000 patients that are on tube feeding at home that our Mayo Clinic team follows, and our research shows that at least 55% of them do some blending in some capacity, whether it's one meal a day, one meal a week, or just a birthday meal or something like that. So it is a large percent, and therefore this is the recipe that we have created. It can be modified to, make a 1,500 calorie recipe or things like that, but it's a good start. And each of the foods we have actually tested. I think 2011 is when we actually tested these recipes. So honestly, it makes me a little bit frustrated that we're in 2023 and finally these ASPEN guidelines are going to be published, but nevertheless, we are there. So this is a recipe that we do use a lot, and we have tested each of the foods on this list. Now, I normally tell people, once you're comfortable with like oatmeal, yogurt, milk, banana, green beans, and chicken, once you get that blend down and you're like, oh yeah, I know exactly how long to blend it, I know the consistency, I don't have any chunks, then it's perfectly fine to open up other foods. Like, okay, let's change out the banana for blueberries. Let's change out the mandarin oranges for something else. But it's just hard to test every single food combination. So it's a good way to start. And like I said, it's what most of our patients use. So this is actually an example of what those 500 calorie recipes look like. So each of those jars are a meal. based on the 500 calorie recipe. And then that is the varying volumes that those meals produce. Like I said, this mom is amazing at making colorful blends and really wanting things to look pretty. So she knows which foods to choose in each category to make these colors. But you can see the amounts are a little bit different, and each blend looks different, just like our meals that we would choose to eat orally. Another way that you can make recipes is using My Plate on the myplate.org website. So there's really two ways that you can do it. You can make recipes for ages 1 through 8, and those are based on average weight and height of a child at that age. And then there's a category where you can make recipes for 9 and older that actually do allow you to put in height, weight, and physical activity to help you develop a calorie level that you're trying to make the recipes at. So this is what it would look like for a 14-year-old, for example. So it would tell you, okay, I put in height, weight, activity level, and it told me that I needed 2,800 calories. And then it tells me from each category of food, how would I make a blend that would meet all my carbohydrate, protein, and fat needs, but also micronutrient needs without needing to add supplements. So some of the questions that we get about any of these three options, and you can see this picture here. This is actually from a while ago, but I always think like, I wonder if my kids know what I do. And I walked into my daughter, at the time she was 7, playing dolls, and I walked into her room and this is what she was playing. And I said, what is this? And she's like, well, my doll needed a feeding tube. So I put her backpack on her wheelchair and she's just fine. So I was very impressed that she came up with that on her own. So for questions people ask, do I need a multivitamin? In the guidelines, we have basically said the general answer is no. So you should be able to get all of your micronutrient, all your vitamin, all your mineral needs with blending foods. But that being said, if you have volume restrictions or food restrictions, you may need a multivitamin. That's where the complete website can be helpful, because it actually tells you if once you make your recipe, if you're low in sodium or low in calcium or low in iron, it would tell you how much you might need to supplement. But in general, you should not need to take a general multivitamin. Same thing with salt. I will say that when people start blending their own food, they get really excited about kale and blueberries and sweet potatoes and all these healthy foods that we want to get into our bodies. And they forget that we still need ranch dressing, because ranch dressing is giving us sodium, potassium, and some other micronutrients that we don't really think about. And not that you need ranch dressing, but it is a really good way to say, like, okay, if you're doing broccoli and carrots, just do a squeeze of ranch dressing in there, just like you would if you were eating them by mouth. And that can really help get those minerals that we might not be getting if we just use all foods that are not processed at all. How much water do I need? Well, our water needs really don't change based on if we use a liquid commercial product, a commercial product that's blended, or if we blend our own food. In general, we feel like when you make your own blenderized formula, it's about 70% fluid. So if you would calculate, okay, I made 1,000 milliliters of blended food, 700 milliliters of that can be counted toward my fluid goal, and then add fleshes on top of that. A lot of people that do make their own blends choose to give water or fluid outside of the blend, because it can just add a lot of volume. So when you think of water, water doesn't have to be digested, it's just absorbed. So I give water fleshes, it probably leaves my stomach within 5 to 10 minutes. If I put more water into my blend, now I've made this bigger volume of diluted formula that has to be all digested and absorbed, and might just lead to some volume intolerance. And so normally, in general, we like to give the water or other fluid fleshes like Gatorade, Powerade, Pedialyte, almond milk, anything can be used as fluid flushes outside of the blend. But 70% water is kind of what we're estimating that most home blends are. Can I use the same blend every day? Absolutely. You can use the same blend every meal, every day. You can change it up every meal, every day. There's really no right way of doing it, as long as we know that the blend that you're using every single day gives you all of the nutrients that you need with or without supplementation that you might be making. So like I said, aren't these colors just insane that she can do? It's really... And then she puts placemats out. You can't see it very well, but this was for Christmas. Actually, she had this placemat out with red and green and white on it. So really making that mealtime a lot more fun for her child than I think I would be able to do for sure. So just some tips from consumers, but also from people in the group. So we had people from the US and Canada that have a big portion of their practice using blenderized feedings at home. And one of the recommendations that was given was using a coffee grinder to grind up vitamins, nuts, or seeds before putting them into a blend, because it can kind of pulverize them into a powder so it blends easier. Keep the skin on the fruit for added fiber. Warm blends definitely push easier with a syringe. They flow easier in a large bore gravity bag. They flow easier in a reusable feeding pouch. Cold blends usually don't feel quite as good going in, but are definitely take more force to push and a little bit harder to get through the tube. And then another good tip, and this was a tip I got from the group because I hadn't thought of this before, but as we're cooking vegetables, using that water as what we use for water flushes or for the fluid in the blend to help thin it down, just so we're not losing those nutrients that are coming out in the water from boiling, like potatoes, or even if it was oatmeal or rice or something like that that still had some liquid left, using those. So how can I save money? Some people are worried that, okay, if I do this, it's going to increase my grocery bill. So buying foods in bulk can really help, especially if you're batch cooking a 14-day supply at one time. Having pinto beans that you buy in a bag that you cook are a lot less expensive than buying canned pinto beans, for example. Using frozen, canned, or jarred vegetables is perfectly acceptable and a way to save money. And then you can buy online refillable food pouches. There's many different brands of them. Some of them are available through your home medical equipment company as well, but these can be washed and reused, and so if you were needing to purchase them out of pocket, sometimes it can be less expensive than, for example, buying like breast milk freezer bags is kind of what people had told me they had used in the past, but those really can't be washed and reused. And so if you were using that to freeze blends, then that could get costly. So these pouches can help save money that way. How can you save time? Well, you can make a large batch of blenderized feeding at one time and freeze them to use at later times, as well as use things like an Instapot or a slow cooker or a crock pot to make proteins and grains and vegetables in large amounts, just like we do to save time when I throw food in the crock pot. And when I leave in the morning and it's done at the end of the day, you throw food in the crock pot in the morning, and then at the end of the day, you can maybe do a batch blending with some of the foods that you have prepared in the crock pot. And then get creative. So I've had people say they use muffin tins, ice cube trays, also just freezer bags flattened in the refrigerator. A tip one mom gave is that putting a piece of parchment paper in between the freezer bags can help so they don't stick to each other, because when you put that warm blended food in the freezer and then it freezes, all the bags want to stick together. And so she showed how she put a piece of parchment paper in between, and that really allowed her to stack things in her freezer rather than having kind of bulky bags of like frozen muffin size or ice cube size things. But different things work for different people, definitely. So I know I ran through that kind of quickly, but I do want more time for questions because I know the specifics of starting doing home blending or prepared blenderized feeding may be daunting, but I do feel like it is kind of the wave of the future as an option for people who are on enteral nutrition long term, especially now that we have, many people just like on parenteral living decades that may want different options. And if you want to stay on commercial product for the rest of your life, that is totally fine too. I don't want to discourage that, but I'll open it up for questions if people have specific questions about blending. And I think we have microphones over here, which might be helpful. That way the people that are listening to the live stream can hear the question and the answer.
So my question is about, I have one serious and one silly question.
Okay.
The serious question is, has there been any conversation about using like a commercial USD approved sanitizer like Star San instead of bleach to decrease that risk of like improper rinsing and then you accidentally feed a small amount of bleach versus like Star San where it's technically safe to consume?
No, but can you write that down, that name of that product down for me? Because no one in the 2 years that we met ever brought up that product. So yes, I would love to look at that.
And then the silly question is, Miss Maisie here is my lovely girlfriend, and she's made the joke that in PN nutrition, it's frowned upon to do PN slushies. Mm-hmm. Is the same true for enteral slushies?
Really good question. So before like 1970, our option was EN slushies. There weren't commercial products. And it wasn't frowned upon then. Some people in this room may have learned that in their internship or in their training to become a dietitian, because in the 70s and 80s, that's what we had. Once commercial products came on the market, it became very taboo to do your own blending. And that's where people went into hiding, basically, and said, I don't want to tell my doctor I'm doing this because I don't want to get in trouble. Over the last 10 years, we've seen a shift into, especially just as we learn more about our food supply and foods that are good for our bodies and maybe foods that we want to limit in our bodies, it's becoming more accepted for sure, but I don't feel like we're at the place that we want to be at. And I do feel like these clinical recommendations, which is 69 pages long, coming out from ASPEN is going to be a huge step in the right direction because it's a large national organization that's saying this is safe and fine to do, and hopefully that will take the taboo away from the slushiness. Anybody else? Go back here first and then here.
Hi. A question my husband and I had, and one reason why we aren't blending our own food is because it has to be a certain consistency to get through the tube. Mm-hmm. And once you run your food through the blender, then you have to loosen it up a little bit, either with water or tea or juice. And so our concern was, is he getting the right amount of nutrition after we thin out the food?
Mm-hmm. And I think that's a fear that a lot of people have because you can't look at that label and say, oh, this is exactly what I'm getting for sure. I think you would be very surprised at how little or how thick of a formula would actually use. So applesauce consistency is the easiest way to describe what a lot of my patients use. So you might be feeling like I need to get like a thin smoothie type of consistency, and that's what feels like we have to add a lot of fluid to. But really in theory, you shouldn't have to be adding extra fluid. You should be able to blend food in a blender and be able to get it to about applesauce consistency and give it without adding a lot of fluid.
Okay, thank you.
Does the paper address the impact of using home blends to insurance reimbursement for the supplies? Or also does it also address how can we advocate for insurance coverage for the commercial blended formulas?
Yes, it does address that. And obviously, the cost of or the reimbursement is different based on what insurance you have. But for example, if you have Medicare and you're home blending and you're not ordering a commercial formula, you lose your reimbursement for the supplies that you need. So if it's extension sets or syringes or anything that you're using, those things would end up being paid for out of pocket if you're Medicare. For example, in Minnesota, we have 100% coverage for all commercial Blenderized products. And that was an advocacy effort. I know not every state is that way, but that is part of what is on Oley's advocacy agenda is kind of nutrition support is a right for all people, and all people should be able to choose if there's a product that they would prefer to put in their body versus another one. So it's in the paper and on the advocacy agenda.
My question was similar to the one that was asked earlier. And when you say applesauce consistency, and you showed the ITSE chart earlier, what ITSE level does that meet? And is there a level that you would say it's a no-go and you have to stop there?
Yeah, so I'm gonna go back to that really quickly. It really depends on the administration method. So for example, if you syringe your food, and I mean push it, not gravity syringe, let me get back to here. And the paper addresses this. Oh my goodness, sorry. It doesn't want to go as fast as I'm pushing the button. Okay, so all of these liquids will work. So extremely thick liquid will work with a syringe. Moderately thick liquid will likely work with a large bore gravity bag, and slightly thick liquids will work with a pump. So if you saw on this slide, it goes into food consistencies, which you might be used to, like mechanical soft, pureed, things like that. Those will probably not work at all. But anything extremely thick to slightly thick will go through a 14 French or greater tube. It just depends on how much force is needed to get that liquid in. And that's why, like, if you have an extremely thick liquid, you would need to push it in with the syringe versus a moderately thick would flow in a large bore gravity bag, or a mildly thick would be able to be pumped through a pump.
Thank you.
Yeah.
Are you guys addressing at all the problem I'm running into with nurses at school refusing to push a syringe? Nowhere in California will they push a syringe. They want it to gravity flow. So we cannot get anyone to push a syringe.
So this isn't in the paper right now because, as you can imagine, after 6